Hi, everyone. I have a really special guest, and I am so excited to have her. I came across her on YouTube, and she has the BRCA Boss YouTube channel, and she's actually a doctor, a physical therapist. Her name is Jamie. So, Jamie, go ahead and tell us a little bit about yourself, and thank you so much for joining us today.
Yeah, thanks for having me. So like you said, I'm a doctor of physical therapy. I have been practicing physical therapy for 10 years now. I was diagnosed with BRCA1 when I was 30 years old. I always kind of figured I had it just because my mom was diagnosed with breast cancer at the age of 45 and her sister was diagnosed at the age of 29. So right then and there, they were pretty sure that they had the gene, but nobody at that time was getting tested. I was 18 years old. I was 18 at the time.
Mhm.
And it was such a new thing that insurance didn't cover the test. So it was going to be like $1,800 a person to get the test. And at that time, there was still the pre-existing conditions clause in health insurance. So if I got tested, I was fearful that I would never be covered by health insurance. So I just kind of figured, okay, I'm going to pretend that I have this gene and I'm going to be super proactive and be really healthy with eating healthy, working out, which I already did. As I got older, I started looking into, non-toxic products and kind of all of those things. The reason it all started for me to get tested was I went in to get tested for all the genetic testing for my son when I was pregnant. And the doctor at that time kind of heard my history and he said, well, he's like, have you been tested for BRCA?
Mhm.
And I told him no, because of the pre-existing conditions. And he's like, oh, well, that's been cleared now. Now insurance can't prevent you can't not get insurance because of pre-existing conditions. If you have it, insurance companies will start to pay for screenings. So as of right now, I wouldn't be able to get a mammogram before, if I didn't have the test, I wouldn't be able to get a mammogram until I was 40.
Yeah.
But if I have it, then I can get the mammogram once a year at the age of 30. I think even in special instances, you might be able to get it in your 20s. So you did get tested?
I did. And
Okay.
mine's a bit of I just had a feeling to get the test. And then I went and got it. It's like you have that intuition
Mm-hmm.
voice, and it came back positive. So I started my screenings. In my first appointment with an oncologist, she felt
See, you got to listen to your gut. You got that intuition is there for a reason.
hmm.
So I'm glad that worked out for you, that you found it.
Me too, because if I would have waited till December, this was in I think May of 2018. And if I would have waited until December when I normally went to the gynecologist, it would have been, hopefully I would have felt it by then. It was triple negative aggressive, but it would have been a whole different ball game. So, and it is
Definitely.
important for everyone. I've heard other people have stories. I felt like something was wrong and my doctor didn't listen and they did end up having something. So it is a good reminder for all of us at any time, whether it's to do with our bodies or maybe with your kids or whatever else, like when there's that gut feeling, to listen to it. And so I was curious, so when did you decide about having your preventative surgery?
So like I said, so we first started talking about getting the test. I was 30 and pregnant with my son. I think, you know what, I actually ended up having the test afterwards because they wanted my mom to get tested first because she had the breast cancer. So they said, well, let's get her tested. If she doesn't have it, the chances of you having it is going to be significantly less. She tested, she had it. So I got tested just a couple months after that. So I was 30 when I got tested, but I was still breastfeeding my son and we knew we wanted to have more kids. And honestly, I don't know, maybe just the fact that for years, I figured I had it. So it wasn't like getting slammed with something for me. It was like, okay, yeah, I have it. So now what I'm going to do with that. Um, I wasn't sure if I was going to have the mastectomy. And when I'd spoken to doctors about it, they'd kind of said, well, the mastectomy is an option. We don't really push for it because with breast cancer, you can usually palpate a lump. And so it's not quite as scary as the risk of the ovarian cancer.
Mhm.
but the numbers are different. So with my family history and the test, they had put me at about a 70 to 80% risk of having breast cancer by the time that I was 60, which is a huge number. But typically, and not always, everyone has a different story. But a lot of times if you have breast cancer, you can palpate the lump and you can have treatment. But of course, I didn't want to go through chemo and radiation and all of that, and the scare, the fear.
Mm-hmm.
Anyways, we just decided, okay, we'll kind of deal with that when we're done having children. So we knew we wanted to have our kids close together. So 2 years later, I got pregnant with my other son. In between the two, I actually did stop breastfeeding my son, my older son, first, or early. I wanted to go a full year, but we knew we wanted to try to have them close together. So it was around that year mark that we were going to try for child number 2. So I stopped breastfeeding him at about 10 months because they wanted me to not breastfeed for 4 months before I could have a mammogram. And so I stopped breastfeeding him. I had a mammogram. It was the first one I'd ever had. And that was so that we could have baseline. And then I got pregnant again, breastfed my other son for about a year. And then around that time, I was, so what was I? 33 at that time. And I still just kind of, it was in the back of my mind, but I wasn't really too worried about it. Once I hit the age of 35 is when the doctor started telling me, they said between 35 and 40 is when you really want to start thinking about having your ovaries out. So the risk for ovarian cancer is significantly less. It's about, I think it's 20 to 30%. However, with ovarian cancer, you don't typically show symptoms until you're stage 4. So even though the risk is less of me getting it, the risk of it being, deadly is increased if I were to get it, and you just can't tell that you have it. So the mastectomy actually came up because I started researching if I need to have my ovaries out. I started searching around. I wanted to find if there was some sort of alternative method, because to be perfectly honest, I really don't want to go through menopause before I'm 40. I have 2 young boys, they're 3 and 5. I'm exhausted. I work full time. I need my energy. So to go through menopause and not have my energy just sounds awful. But so I started looking into that, and I went and I saw a holistic type physician. He's actually was an MD, and he actually switched over to the holistic side. And I met with him, and he even said, well, there's some things that we can do. We can try to boost your immune system. There's definitely some treatments I can offer you, but there really is just no research and there's no baseline. So if someone comes in, he even said this to me, he said, if someone comes in to me and has cancer, they already have cancer, they're going to be getting treatments. I'm never going to tell someone not to have westernized medicine, and it's totally their choice, but we can try other things and we can still check their scans and see if things are getting better or getting worse. He said, with you, we have no idea if anything's working. So, he couldn't tell me what to do, but I even flat out asked him at one point, I said, if it was you, what would you do? And he said, he's like, I already had prostate cancer and I went through that. So if I were you, I would probably just have my ovaries out. And I was trying to see physicians about what I should do and the research and all of that. And I got stuck in this really weird spot where my physician referred me to all these other physicians, but I got blocked by every front desk. And they would always ask me, they're like, do you have cancer? And I would say, no, but I'm BRCA1 positive. And so they would say, oh, well, if you don't have cancer, then we can't see you. And it was just odd because I've spoken to those physicians since, and they were just floored that their front office did that, because they were like, no, you absolutely need to be seen by a physician because you need to learn about what to do. Mm-hmm. So in the long run, I ended up getting referred to Stanford because nobody would see me. And initially I kind of was excited because I was like, oh, well, Stanford has this huge program and they have so many doctors. And I was told that I could actually have the mastectomy and my ovaries out at the exact same time and just kind of kill 2 birds with 1 stone, be under anesthesia, less time. And that's what I actually thought that was going to benefit me by going to Stanford. However, when I got there, then I found out about other alternative treatments for reconstruction. And before, I had only really heard about, I'd heard about the breast implants, and I knew there were different flap procedures like latissimus flap and tram flap. My mom had the tram flap 20 years ago, and it was a nightmare. And she's had back pain ever since because she can't sit up because she doesn't have a rectus abdominis, and it was just super complicated. So I didn't want that. But I did like the idea of using your own tissue, but I didn't want someone taking my rectus abdominis musculature because then I wouldn't be able to sit up, and it's just a really hard recovery. So when I got there, I found out about the DIEP flap reconstruction, which is where they don't take the muscles out of your stomach, but they take the fat out of your stomach and they replace your breasts with that tissue. I am a little bit on the thinner side, so I didn't know if I was going to be a candidate. But when I went there, he said I had just enough to maybe make me about the same size that I was, which wasn't very much. But that's not, you know, I wasn't doing this to have a boob job, right? Like I'm doing this to decrease my chances of having cancer. So long story short, I ended up opting for that procedure. And because of that, I did not have my ovaries out because it was already a 10-hour procedure, and they're already taking tissue out of your stomach, and it's a really hard procedure. So, with that procedure though, there's usually a second phase and a touch-up phase. And so they had said that I can get my ovaries out then, when I go in for my touch-ups. So I was going to wait. I actually was going to wait more till I was 40. Cause I was like, okay, let me just wait till that like very edge of when I can keep my ovaries. But, after going through this procedure, I didn't respond. I mean, everything went well. I didn't get sick, but I got really sensitive to the anesthesia. I had anesthesia, that brain fog for 6 weeks. And I did not enjoy that. So I think I'm just going to go ahead, and when I go in for my phase 2, I'm going to go and have them take my ovaries out then. So that'll be later this year.
Are you going to do ovaries and fallopian tubes or?
Yes. So sometimes they'll offer just ovaries. They're actually, I think it's getting to be standard of care to take the fallopian tubes with the ovaries now. Because actually what they're finding, they think that ovarian cancer actually, that it actually starts in the fallopian tube and that it metastasizes to the ovaries. There's a lot of research showing that. So some women actually choose to get their fallopian tubes out first, just to kind of hold off a little bit longer and then get their ovaries out. Other women actually, there's some women that get full hysterectomy, which I personally don't want to do, but
I've talked to a couple of people, and yeah, it seems like the less that you can do is better. It makes sense medically, and everybody agrees for sure. So I'm glad we got to chat about that, because I'm in the same place that you are. At some point, you know, my doctors have encouraged me to get these ovaries out, like after I've had kids, and, you know, they're like, the sooner the better. And it's a lot of pressure, especially after going through breast cancer treatment. I'm almost like, okay, I just need to be left alone for a little bit, you know, but I know their job is to prevent cancer from happening. So I see it from a doctor's point of view. And since you're a physical therapist, I would love for you to chat with us. And since you had a